Now with Dr. Darien taking a look at a major report from the Surgeon General on the ongoing dangers of smoking. What do we need to know?
So this is an 800-plus page report that was just produced this morning around 5 a.m. regarding the dangers of smoking. We all know that smoking has trended honestly lower, and it's been for good reason. There's been a lot of public health incentives and initiatives and education. However, disparities still exist. 36 million adults and about 760,000 children still smoke. And those disparities are most notable in certain communities. American Indian, Alaska Native, for example. Also, social economics is also a part of this. Those who are in poverty are 2 times more likely to smoke than those who are not. And so the Surgeon General is making this statement to help us understand that these disparities still exist, and it's still the #1 cause or a common cause of cancer and death, killing about 500,000 people each and every year.
So my question is, if you smoke and you want to quit,
yeah,
how much does it help you?
I think to understand, #1, that most insurance providers, and Medicaid and Medicare included, are required to cover some level of tobacco cessation. So that includes counseling, that includes certain medications, that includes possibly even therapy. So looking at your coverage, talking to your provider, and coming up with a plan. And the Surgeon General also notices things that we can change in terms of our federal organization. For example, limiting nicotine. This is something that we've been working to do. The goal is to prevent the average 33 million people from starting cigarettes, also limiting menthol and flavored tobacco. These are decisions that are federal decisions, however, so we'll have to wait and see how that pans out. But overall, making that decision at home is the most important. Talking to your friends and family about addiction, talking to your provider, and coming up with solutions that fit for you.
And there's help out there.
There's help out there. And many people are not aware that access is available to them. So it's really important to know that.
All right, Doc, now we know. Thank you very much.